Welcome back to the nationally syndicated Price of Business Show. I'm your host, Kevin Price, talking to you about you and your business. Let's face it, health, public health, all things health, that is all of our business. And there's no one I'd like to talk to more about this topic than Dr. Bob Arnott, who is a recurring guest on our program, a show favorite and a personal favorite. You know him from his work as a medical journalist for NBC and CBS, New York Times best-selling author, and really one of the most engaging personalities I get to visit with on the show. One of those rare people. You know, Bob, when you've been doing what I've been doing as long as I've been doing it, 3 decades next year, you begin to become a little callous about guests. It's like, oh, great, it's a guest. Oh, look, another New York Times best-selling author. You know, it gets old after a while. Never gets old when you and I chat.
It does, especially after 30 years. Oh, my God.
Yeah. Yeah. So after a while, it's like, you know, oh, well, great. Oh, I got a presidential candidate on. That's fun. You know, but I never feel that way whenever you're on. I always get excited. Frankly, you bring so much diversity of topic and ideas that I just find it really stimulating and always a lot of fun. Love having you on. And real quickly, let's kind of do a panoramic overview of our topic today, because we are in the beginning of a new year, and in the beginning of a new year, I think about some of the big issues that we should be thinking about, and certainly healthcare and public health should be on top of mind in 2023. I almost said the wrong year. But talk about that. Kind of give me what initially comes to mind on this topic, and welcome.
Well, you know, it's always such a pleasure to be here, and you do such a wonderful service for your viewers, which is why they're so loyal, and I am too. Now, the interesting thing to me is this. So, as you know, I'm co-CEO of this group, Health Tech Without Borders, and what we do is we deliver care digitally. We go a lot in Ukraine and overseas right now, but with the partners that I have at major medical schools in America, and especially in the emergency front, I just see this almost collapse of the system. As an example, you know, right here in New England, you can't get, by and large, an ICU bed. I mean, let's say you have some terrible disease. There's nowhere to transfer. Kids now with RSV, we've seen that, this respiratory syncytial virus that is really kind of a peak now. You can't get a kid, by and large, into an ICU if they need it. And what really astonishes me is I sent a patient into what I consider one of the best hospitals in the whole U.S. for a major surgery for cancer. And they did a very good job on the cancer. And then they had a complication, and they just kind of threw up their hands. I mean, people have a chance, or doctors have a chance to do the one thing they do. And, man, if you have any kind of a chronic illness or if you have a complicated problem, it just falls through the cracks. And then with public health, I mean, I just feel so badly, you know, for so many of these southern states, you know, like Mississippi is an example, where they almost don't have any public health at all. I mean, you know, the clinics and the funding aren't there. People aren't getting their vaccines just for routine stuff. I don't care about COVID, just for flu and whatnot. And so I just think it's a travesty. You know, we have the best potential in the world in terms of, you know, medical schools, the training, the expertise, the operations, the pharmaceuticals, but the delivery is just plain falling on its face.
Yeah. Talk about, you know, you open it up by talking about a digital approach, virtual approach to healthcare. And I keep getting these stories that I see that are almost, you know, optimism there of what we can do, particularly like with nurse practitioners. And yet it never becomes ubiquitous. I look at a place like Texas, where we're located, where the Price of Business Show is located. And this is a state that has so many miles between small towns, and yet they're not allowed to give nurse practitioners the kind of autonomy they need to be able to service their communities. They have to be done under a doctor. There's all kinds of really ridiculous restrictions that in states that give more autonomy to nurse practitioners exercise freely. We need to be thinking, in my opinion, more and more in how to give more flexibility to these people in order to make it easier for them to serve these communities.
Well, you're so right, because, nurse practitioners can hang out their shingles in something like 38 states. So it's just pure professional rivalry when, when doctors can't provide the services because there aren't enough, and yet restrict nurse practitioners, which is just plain wrong. But you asked a great question about the digital delivery of healthcare, and I do think it's a big solution. I mean, as an example, so we have now done 62,000 telemedicine visits in Ukraine, right up on the front line, right in. I mean, imagine in Texas, you could be in a rural community with a doctor. In Ukraine, you could be on the front line with their, rockets and Iranian drones overhead crashing into buildings and whatnot. So you have to stay underground, and we provide the care. But we've learned a lot in Ukraine. We can basically deliver 90% of non-emergency care by telemedicine. 90%. It's amazing, and we have the best qualified doctors out of Massachusetts General Hospital. We have 800 doctors who have volunteered there, 600 who have volunteered out of Stanford, treating, both sides in Ukraine, both the Ukrainian side, if you're, a Russian sympathizer in another part of the country, we don't discriminate at all. But I think the interesting lesson here is that
for the rest of the interview, check out the link below.